Hey everyone, welcome back. So today we've got a really fascinating explainer lined up for you. We're going to completely demystify a medical condition that, honestly, sounds incredibly intimidating on paper. And yeah, it can be pretty scary if you're actually experiencing it. But stick with me, because by the end of this, you're going to understand exactly what's going on under the hood. We're talking about the heart, specifically its electrical rhythm, and what happens when that rhythm gets completely hijacked.
Just imagine waking up one day. Maybe you're just going for your usual morning walk, and suddenly you feel completely off. A real patient actually described this bizarre, really unsettling sensation like this. They said it was a feeling like a butterfly fluttering or a jumping fish in my chest. And along with that deeply uncomfortable physical feeling, they started getting this totally unexplained fatigue. Dizziness. Things they used to love doing, like exercising, suddenly left them feeling absolutely awful. It's super alarming, right? It's exactly the kind of visceral, out-of-nowhere experience that sends you rushing straight to the doctor's office looking for answers.
So let's get into Section 1, Mysterious Fatigue and Palpitations. We're going to step right into the doctor's office alongside our patient to figure out exactly what's causing that crazy, jumping fish feeling.
Now, when the patient sat down, the doctor dropped a term that sounds like a massive mouthful of medical jargon: atrial fibrillation, or AFib for short. At first, the patient was completely lost, and I mean, who wouldn't be? But when we actually break it down, it's pretty simple to grasp. AFib is an arrhythmia, and all that really means is that the heart's electrical signals have gotten disordered. They're all out of whack, which causes a rapid and highly irregular pulse. So instead of a nice, steady, reliable beat, the heart just starts acting totally unpredictably.
What's really fascinating here, though, is the sheer variety of ways AFib actually shows up, or doesn't. We've got the classic symptoms, right? Unexplained fatigue, dizziness, maybe episodes of fainting, shortness of breath, a general feeling of weakness, and sometimes even chest pain. But here is the massive curveball. Some people have absolutely zero symptoms, none at all. They could literally be walking around with their heart racing all irregularly and be completely clueless until a doctor just happens to catch it during a routine health screening. It really hits the nail on the head as to why regular checkups are just so absolutely crucial.
Okay, moving on to Section 2, the heart's electrical system. To really understand why these symptoms happen, we need to kind of shrink ourselves down and peer right into the machinery of the heart to see this literal short circuit happening.
I want you to think of your heart like a highly sophisticated machine run by its very own internal power grid. In a normal, healthy heart, you have this master power plant located in the upper right side called the SA node. It generates these perfectly timed electrical signals that travel down really organized pathways, telling the heart to pump oxygen-rich blood smoothly to the rest of the body. But in an AFib heart, that power grid goes completely haywire. Instead of just the main power plant running the show, you get these rogue sparks of electricity firing off rapidly all over the place. And these chaotic sparks, they usually originate from the pulmonary veins, which are the blood vessels that bring oxygen-rich blood from your lungs back into the heart.
So here's where it gets wild. These rogue, chaotic signals from the upper part of the heart start rapidly traveling down toward the lower ventricles. And on their way, they have to pass through this sort of electrical substation called the AV node. But this substation just gets entirely overwhelmed by all these rapid, disorderly signals. The electricity passes through erratically, causing the whole lower heart to be completely out of sync. And that rapid, unpredictable twitching, that is precisely what creates that terrifying jumping fish sensation our patient was feeling earlier.
Which brings us to Section 3, the true danger of AFib. Because an irregular pulse isn't just some uncomfortable feeling. The medical stakes here are incredibly high.
Just look at this number, 33 million. That is the estimated number of people worldwide currently living with atrial fibrillation. It is wildly common. In Japan alone, there are well over 1 million patients. Actually, it's one of the most common arrhythmias on the planet, making up over 30% of all hospitalizations related to heart disease. Honestly, if you don't have it yourself, the odds are really high that you know someone who does.
And the age demographics really paint a clear picture of exactly who's at risk here. While the overall prevalence in the general population sits at maybe 0.5% to 1%, just look at how drastically that risk skyrockets as we get older. For folks in their 60s, it jumps up to roughly 3.5% to 4%, hit your 70s, and it doubles to 7%. And for those over 80, a full 10% are managing AFib. It's a condition that's deeply, deeply tied to the aging of our body's internal machinery. So why is this chaotic rhythm actually so dangerous? Well, it all comes down to basic mechanics. The word fibrillation essentially just means quivering.
During AFib, the upper chambers of the heart aren't pumping vigorously, they're basically just quivering like a bowl of jello. And because they aren't squeezing properly, the blood isn't being pushed out effectively. It slows down, it starts to pool inside the heart, and what does stagnant blood do? It clots. If one of those blood clots manages to escape the heart and travel up to the brain, it blocks an artery, and that drastically, terrifyingly skyrockets a patient's risk of suffering a severe stroke.
And it gets worse. Because AFib is a progressive disease, it usually marches in stages, starting from a first episode to paroxysmal attacks, the kind that come and go, then turning into persistent AFib, moving to long-standing persistent, and finally permanent AFib. Because of this relentless forward march, getting early medical intervention is absolutely critical. You do not want to wait around with this.
All right, take a deep breath. I know talking about strokes and blood clots is super heavy, but modern medicine is pretty amazing. Let's head into Section 4, Treatment and Hope for the Future, and see how our patient found some actionable solutions with their doctor. So the very first line of defense is just taking back control of what we put into our bodies. Doctors highly recommend some immediate lifestyle changes. We're talking adopting a heart-healthy diet, getting the right amount of exercise, and absolutely quitting smoking and cutting way back on alcohol. This helps lower the risk of related issues like heart failure. And secondly, to combat that terrifying stroke risk we just talked about, doctors will often prescribe anticoagulants. Those are essentially blood thinners that stop those dangerous clots from ever forming in that pooling blood.
But what about actually stopping the AFib itself? Well, that brings us to this seriously fascinating surgical procedure called catheter ablation. It sounds like straight-up science fiction, but it is totally routine today. Basically, a doctor inserts a very thin, flexible tube, a catheter, into a blood vessel, usually down in the groin, and carefully threads it all the way up into the heart. Remember those rogue electrical sparks coming from the pulmonary veins? The doctor uses this catheter to create tiny, strategic burn scars right around the entrances of those veins. And since electricity cannot travel through scar tissue, these little scars act like a literal physical firewall, completely trapping and blocking those chaotic signals from ever reaching the main heart muscle.
And the engineering behind how they build that firewall is just mind-blowing. There are two main methods doctors use, and they are extreme opposites. The first is radiofrequency ablation. This uses an electrode catheter to deliver intense heat, carefully burning tiny dots one by one and connecting them into a solid line of scar tissue. The second method? Cryoablation. This one uses a specialized balloon catheter. Once it's in place, the balloon inflates and uses extreme freezing temperatures to treat the entire entrance of the vein all at once in a single shot. Extreme heat or extreme cold. Depending on the patient's specific condition, the doctor gets to pick the absolute best tool for the job.
Ultimately, after going over all these options, our patient left the doctor's office feeling this profound sense of relief. Because the goal of all these treatments, from the diet changes to the blood thinners, all the way up to the high-tech catheter ablation, it really comes down to two simple things: extending the patient's life and vastly improving the quality of their everyday living. By restoring order to the heart, patients can finally get back to feeling like themselves again. They get to return to the activities they love, without that jumping fish in their chest holding them back.
Which leaves us with one final thought for you to take away from this explainer today. Your heart beats around 100,000 times a single day, entirely in the background. But when was the last time you really paid attention to it? Whether it's finally scheduling that overdue checkup or just being a bit more mindful of some unexplained fatigue you've been having, I challenge you to ask yourself, are you listening to your heart's true rhythm? Thank you so much for hanging out with me today. Stay curious, stay healthy, and I'll catch you in the next explainer.